Let's do elimination process together. So, and let's read about A. Avoid excessive intake of green leafy vegetable. What about that one? In patients with coumarin, okay, taking coumarin, what's the action of coumarin in your human body? What it does?
Anticoagulant.
Okay, so when the patient is taking coumarin, what kind of tissue you will provide to patients? Are they able to eat green leafy vegetables or not?
No.
Okay, now
Because,
look the trick of
because you
the
got
right here.
vitamin K.
Look the trick of the question right here. The word excessive. If I give you in your answer avoid intake of green leafy vegetable, you cannot choose that answer. Because in whoever we comment, we cannot restrict people of vitamin K. We just explain to the patient as a nurse, you can eat a low vitamin K diet with consistent vitamin K diet, but not, avoid vitamin K diet. Now, when this says to you, avoid excessive, yes. I'm not saying you cannot eat it. I'm just saying to you, avoid excessive. And that's the reason the answer, as you say, it's A. But if I give you in the answer, avoid intake of green leafy vegetables, and not using the word excessive, that statement is wrong. All the statements can be low vitamin K diet, eat a consistent amount of vitamin K diet, that would be good. And the reason that happens is because, remember, coumarin, what it does is that avoid the use of vitamin K from the liver. If I'm giving you that medication to avoid the use of vitamin K from the liver, there is no sense that I'm going to give you, green leafy vegetables in the diet because they are rich in vitamin K. And that's the reason. But you cannot choose, and there are many questions that do that. The Nclex do that a lot. So you cannot choose a statement that says avoid vitamin K diet. Sometimes what they do is that they include avoid vitamin K diet and explain to the patient to follow a low vitamin K diet. So low vitamin K diet, it's good, but avoid is not. In this situation, apply by the way excessive, So which means you can eat it, but not too much, in other words. Okay? So when you go to B, eliminate an intake of highly processed food items that is not related with coumarin. And that's the reason you can implement many strategies you can, but it's your lack of knowledge in the subject, you won't be able to answer the question. Potassium and processed food items, it's not related, with coumarin at all. Protein-rich supplement either. And herbal teas, adequate micronutrients intake between A and D. Because some herbal teas will be, really high in vitamin K, but not the one that will ensure micronutrients intake. Because those teas will be nutritional teas and are not related, multivitamin T intake, which is not the same. And that's the reason is A. Out of time when you're choosing an answer, you need to ask yourself why. Why am I choosing that? And this is when you actually know that you are prepared. Let's go to number 3. To prevent the transmission of hepatitis A, the nurse choose to wear gloves during which procedure?
It's B.
Is everyone agree with B?
Yes, I agree with B.
Yes,
Why?
Professor.
Why do you choose B?
Because hepatitis A is transmitted by fecal and oral intake.
Okay, good. Now, that's the answer. I have a question, for you. If the patient has hepatitis A and will be discharged home, what would be the most important teaching to you to provide to this patient that's discharged with hepatitis A?
Don't cook.
Okay. Besides that, what else? Are these people, will we be able to prepare salads or foods at home?
No.
Good. Good. Okay, let's go to number 4. A client with gestational diabetes undergoing non-stress test at 34 weeks of gestation, the baseline fetal heart rate is 144 beats per minute. The client is instructed to mark the fetal monitor paper by pressing a button attached to the fetal monitor each time the baby moves. After 20 minutes, the nurse evaluates the fetal monitor strip, which outcome indicates a reactive non-stress test.
I think it's C.
Everyone agree with C? Is everyone agree with C?
Yes.
What means to you the word reacting non-stress test? Is that what's good or it's wrong?
It's good.
It's good.
They
Okay.
say it's good.
Now, something that happened to many students that I'm not gonna study this subject of maternity and P because it's not gonna be in English. No, you're wrong. You're wrong. Because you have 1% that is in your Nclex exam and it's about health promotion. And you
I
have
think it's D.
many questions. What are you saying?
D, the last one.
The last one, why D?
Because it's a normal test and no fetal heart rate deceleration occur in response to fetal movement.
No, that's wrong. That's wrong. Listen, when the patient is gonna have a non-stress test, number one, we do a non-stress test in order to see how is the fetal well-being. So we expect that during this exam, the fetal heart rate of the baby is going to increase 15 beats, okay, about normal, about the baseline fetal heart rate when the test started, okay. But on the and then is the non-stress test becomes negative or equivocal, then we go and we do contraction stress test. In the one that you see, if there is a late deceleration, so can respond to the fetal movement, it's in contraction stress test, but not in non-stress test. It's completely wrong. So we do non-stress test, and in the non-stress test becomes, it's good, it's not a problem. It becomes negative or equivocal, then we have to submit the patient, okay, to non-contraction stress test. And in non-contraction stress test, we actually will be able to see by Pituzing, because we administer to a patient Pituzing, if there is a late deceleration on it, but not in non-stress test. Okay, the answer is C. It's not B. And there is questions about that, so you have to be careful. You have to make a difference, okay, between one to another. What we're looking, for pretty much in non-stress test is 2 accelerations of 15 beats per minute, lasting 50 seconds, okay, in a time of 10-20 minutes period. That's what we're looking for in non-stress test. And again, if that becomes, completely abnormal, then we transfer the patient to a contraction stress test. Okay, and that's really, really important. So answer is C, you're good. Now, 2 years old with sickle cell anemia and a high therapy temperature 102 Fahrenheit, planning care for the child, which nursing diagnosis as the highest priority. Highest priority. That EST in English means that all of them is important, but there is one of them that is the most important one in patients with sickle cell anemia.
I should take C again.
Is C again? C.
Okay.
C. I think C.
Combination right here. When you look at the question right here and you see in the answer there is any word right here repeated, in the question, and it's repeated, textually in one of the answers, that will be your answer. It cannot be different. But when you have temperature and temperature, sure, look for that. That's a format. It doesn't change. That will be your answer. Also, you can look for allied words. When you have allied words and looking for synonyms, right here. So that also, apply to. And another time when you see that similarity, you can choose that as a right answer. And that's a strategy. And your answer is C. They're not talking about anything else. They're talking right there about temperature. So you have to relate that sign and symptom with what is causing it. And that's the reason C is your answer. Really good. Really good. To evaluate side effects that occur as a result of administration of intravenous mannitol for acute angle closure glaucoma, the nation monitor will lab values.
I should take
I
C
think
again.
it's C, serum electrolytes.
C.
You say D or C?
C.
Okay.
C. C has a cut.
Okay, C has, okay, C has, yeah. What is the classification of that medication?
Because it's a
It's a diuretic.
Okay, for what kind of conditions do you believe the doctor is going to prescribe that med?
Increase intracranial pressure.
Okay, so how do you give it as a nurse?
Can we repeat the question?
Intravenously, orally, intramuscular? Intravenous, right? As the question says to you. Now, before giving obviously, what would be the nursing interventions before you administer monitor intravenously to a patient? What do you do first? What the nurse should do first?
Assess.
Is that medication? If that medication comes in a plastic box or it comes in a crystal bottles? You never see that before? Okay. And
Mannitol comes in a
in a what?
crystal.
In a crystal one. Okay, that is good.
It comes in a crystal bottle. We have to shake it before administrating.
Perfect. You have to check it before because it has sometimes some crystal particles that have to break down before we give it, right? Now,
Right.
what temperature do you give? Do you administer that medication intravenously? Do you administer that medication warm? You give it cold, room temperature?
At room temperature.
Most of the time, mannitol is giving us a warm solution. Okay? So we have to make sure. Okay? And so you can place even the bottle in a warm water. Okay? Not in a warm water. You have to open the faucet in warm water and put it right there and warm the bottle. Okay? Pretty much before you give it. And that will help to dissolve the particles, okay, the crystal particles inside the bottles before we give the medication to the patient intravenously. That is something we have to do. If we don't do that, reactions can occur, absorption of the medications will be impaired, and the one in charge to do that will be the nurse, no one else. So you open the faucet in warm water, you put the bottle right there, and then after it's warm, then you give it. Okay? And that sometimes in your Nclex too. So you have to be careful. Mannitol pretty much is given for all patients that are suffering pretty much with a risk for having intracranial pressure. Patients after head trauma. Nclex is gonna relate, okay, conditions, okay, with that. So they can tell your patient after head trauma, okay, and whoever has a head trauma is very at risk for increase of intracranial pressure. And sometimes mannitol has to be given. Okay? Really good, really good. Let's go to look for something else right here. A female client with genital herpes taking a cycle with Sovirax, which client statement indicates to the nurse that the client understands the teaching provided. The client understands. That means to you, it's a right statement. It's an erroneous statement.
B.
I agree. C.
C as San Carlos, you say?
No, it's B.
It's
It's
B.
B or C? Which one do you think?
B.
B.
B as San boy, right? So
Yes.
that's, remember, it's an STD, right?
Yeah.
Yeah. So
No,
which
no.
means they have to use, okay,
It's a
condoms.
virus. It's not a virus.
It is. It is a virus, okay, but it's a genital herpes, and
Yes.
it's transmitted sexually. So for that reason, protection is really important, okay? Now let's go to 14. When planning care for a client with chemotherapy-induced stomatitis, the nurse recognizes the client is a higher risk for which problem?
D.
D.
Adequate nutrition less than body requirements. Now, in chemotherapy, what kind of nursing interventions you can implement during chemo to minimize stomatitis? So the patient is having chemo, you just want to minimize stomatitis to patient. What do you do as a nurse? How do you can prevent it?
Oh, you provide oral care.
Oral care is important, but you will provide eye chips, and the eyes chips during chemo minimize, okay, stomatitis, and that's a nursing intervention. Sometimes we do it, okay? So let's go to mental health. Client with schizophrenia prepares to leave the mental health unit on the day pass with the case manager. Before the client leaves the unit, which nursing intervention is most important to implement?
C.
Which one do you choose? C?
D.
C as San Carlos.
Yes.
Yes.
Assess for suicidal or homicidal ideation. Really good. And that's a priority in mental health. So whoever is at risk for intent or kill, intent or suicide, whatever, okay, that one, okay, pretty much. Okay, and it's always that the first priority, always look for the patient at risk for intent or suicide. That's really, really important. So now let's go to this one right here. The nurse reviewing diagnostic test for a client with medical diagnosis of chronic renal failure and end-stage renal disease, which group of labs results should the nurse anticipate that this client will exhibit?
B.
B.
It's B.
B.
B has it. These are a boy.
B as in boy, really good. Really good. It's that one. Because on a current renal failure, urine will be high, creatinine will be high, capsaicin will be low. And how do you expect to be for a magnesium right here? How do you expect to be the phosphate in patient with current renal failure? The phosphorus will be high or will be low?
I think it will be high.
Will be high. And that's the reason capsaicin is low pretty much. And that's the reason very, very common in your Nclex asking you for phosphate binder. Okay, phosphate binder medication. In chronic renal failure, do you remember any phosphate binder that will help you to decrease the levels of phosphorus? Mm-hmm. 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 What phosphate binding medication do you remember? Okay, it's part of your. I mean, you can order to. I mean, doctor will order to patients with chronic renal failure. Give me an example of one of them. What about aluminum hydroxide? Do you remember that one?
Which one, Professor?
Aluminum hydroxide. That medication is a kind of the med. It's very common in your Nclex. Okay, and it's given okay for patients with chronic renal failure when phosphorus is high, and that is one of the classification of phosphate binders we can provide for patients with chronic renal failure, and they always okay very common okay that your test okay. Now you have it right here. The home health nurse has determined that 80 years old client has a priority nursing diagnosis of altered nutrition less than body requirement. Does the client functional ability related to this diagnosis? Which action to the nurse implement?
A.
The last one.
Assess the client full likes and dislikes. Okay.
No, it's C.
Why do you think is on? You say C. Review the client's weekly budget for food. Okay, let's go and read this question carefully. Okay. So it says the home health nurse has determined that the 80 years old client has priority nursing diagnosis. Priority. That's a priority. Okay, which means something is happening. Okay, with the way of this patient because it's a priority. Altered nutrition less than body requirement to assess the client record or the client's functional ability related to the diagnosis. Which action to nurse implement? Number one. Is this question about nursing process? Yes or no?
Yes.
No.
Yes.
Yes?
Hey, to assess the client's functional ability related to this diagnosis, which action should the nurse implement?
I would say
So,
A.
out of time when you see assessment, that's a nursing process question.
So
Okay. And when you are, okay, including, or when you just identify what step of the nursing process is including in your question, and in this question is assessment because it's saying to you to assess. You're gonna look for different keywords between your answers. Out of time when the question is saying to you, the nurse is assessing to assess what the nurse should do initial. Okay, you always will look for observe, determine, identify, monitor, gather, determine, Fire alarm, sorry. So when you see any of these 6 words included in one of the answers, that's your answer. Because that's the verbs they use in your question following Bloom taxonomy. And this is how the question format is done. So at the time when they mention to you the net is assessing, okay, the net is going to assess what the net should do initially. Always look for any of these words. And in any of the statements, okay, when you see any of the words, that will be your answer. So as you look right there, A includes observe. It's including one of the verbs that I just mentioned to you. Record, it's not an assessment, okay, on word. It's not an assessment, okay, question, because record the percentage of the diet eating in 24 hours. You are evaluating. You're not assessing. Review the client's weekly budget for food. You are evaluating. You're not assessing right there. So assess the client food on this slide. So you have A and D. Why is not D? Why is not D? After nutrition less than body requirements. Okay, and something is failing right here. It's not related with the patient's okay like or dislike. That's not a cultural. It's not a cultural question. It's not a cultural foundation question. That is what pretty much we choose that because the patient wants to choose a menu, because the patient has problem choosing food. But the question is not saying that to you. The question is saying that the priority nursing diagnosis after nutrition is a body requirement. So right there, I would observe pretty much, okay, what the patient is preparing at home. Okay, because and the reason, okay, we're gonna do that is because you're assessing functional ability. You're assessing functional ability. Assess the client full likes and dislikes. You're not assessing the functional ability of the patient. And that's the reason we have to read really carefully. To assess the client functional ability. So you just want to assess how the patient is doing something. Do you understand what I'm saying?
Yeah, I got you. Is
That's
the
the
conduct
reason
of the
the
client.
answer is A. Really tricky, right? But look what it says, functional ability. So I just want to look at the patient doing something. And the only answer that is letting you know that the patient is doing something is A. Preparing a meal at home. That's it. So you're just gonna make sure, okay, how much that patient, okay, independent will be to assess the ability to prepare a meal. Because is that not able to do it, then what is gonna happen? So of course the patients, okay, we have problems, okay, pretty much with meal times and all of that, and happen, okay, pretty much for example, in patients, okay, well, rheumatoid arthritis. Okay, some of the patients need special devices, okay, pretty much to prepare food because they have, okay, a limit of movements or deformities in the hands, and they don't know. They cannot prepare meals at home independently, and that made them to be so frustrated. They don't eat, and then they will be malnutrited. That would be an example. So I have to assess the patient how to prepare meals. Okay, so what your answer is A. Clear, and that's what I'm looking, okay, in you. It's not how much knowledgeable do you are or are you, I'm sorry, it's pretty much how much you are also as a good test taker. So we need to have knowledge, but we need to be a good test taker people too. We have to be. So we have to read really carefully. Okay, let's go to on question 20. After the client experiences spontaneous eruption on the membranes during labor, the nurse knows the visible prolapse from the umbilical cord. What intervention the nurse implement immediately? So immediately means, okay, highest priority. What do you do first?
C.
the presenting part of it.
I think it's A.
Is he, because if you don't push the presenting part of the colon, you don't do anything giving oxygen to the patient.
Is C as a car. The first one.
Okay, you just say C.
Yes.
Okay, on push presenting part of the core, who say A?
I say A.
On face mask, okay, 6 liters per minute. Number one, we don't give 6 liters per minute, we give 10 liters per minute. Okay, I'm sorry for the file tree. Oh my God, what is happening to it? So on 10 liters, never 6. In prolapse score, okay, in patients with on late acceleration, in patients with on variable decelerations to always 10 liters, okay, on per minute, not 6. Okay, because you have to oxygenate the mommy and the baby. That's number one. And then you're giving 6 liters per minute. My question to you is, after you give the 6 liters per minute, the umbilical cord will continue with the prolapse, or that oxygen will resolve the prolapse of the umbilical cord?
After that, you need to put
It's not.
the client in chest neck position.
And yeah, but I will say that the most important interventions right here will be immediately to resolve the prolapse, because you can give oxygen, but the baby will continue with the oxygen, enough oxygen, because the prolapse of the umbilical cord will continue, even though we're giving oxygen. So, and that's the reason the question is C. We have to push the presenting part of the cord. And sometimes they don't present that push of the presenting part of the cord, but they says to you, leave the umbilical cord with your finger pads. Okay, and that will relieve the compression. Okay, and then that will, okay, relieve the compression. Okay, and then, okay, this is when we change the mother position. After that, I will prepare for C-section. That's the order to follow, you know. But you cannot, okay, immediately, okay, give the oxygen. Number one, letter C. Because that's the priority. The question is saying to you, it's a visible prolapse umbilical cord, so which means the patient has a gush, okay, coming into the vagina. And sometimes the Nclex is very it's not a pragmatic exam. What I'm saying to you, it's not a pragmatic exam, meaning that it's not going straight to the point. Sometimes they go all the way around. They don't mention to you visible prolapse umbilical cord. They will mention to you the patient verbalized to feel gush of blood to the vagina, and there's a gush of blood there. But when you say gush of blood, it means to you that it's a prolapse cord, okay, right there. And if it's visible, okay, we immediately have to relieve the compression. That's the number one priority. Okay? C, that's the answer. 21, when is the best time for the nurse to schedule a client single daily dose of an stomach ointment? D.
At bedtime. D.
Yes, D.
Perfect. Now, what do you give first? On eye drops or ointments?
Eye drop.
Okay. Now, let's say that the doctor orders 2 different type of eye drops. How do you provide it? How do you administer those 3 different eye drops? How many minutes between them?
5.
Okay, 5 minutes. And what do you do after you administer each of them? What do
You
you
tell the
do?
client to lightly, to softly, gently close their eyes.
No. What do you do to minimize, okay, very much reaction for those 3 different eye drops? What do you do to minimize systemic reaction? You may pressure in the inner canthus. That's very common in your Nclex. The doctor orders 2 different eye drops, and to minimize systemic absorption, okay, we have to provide compression in the inner canthus after the eye drop is given. And that is part of your eye drop technique administration. So you must make sure. That is right there. They don't want to ask you any question on eye drop if that statement is not included. They always will ask you for that. Okay? Good. You don't know. The mother of 8-year-old boy tells the nurse that he fell out of the tree and hurt his arm and shoulder, which assessment find is most significant indicator of possible child abuse. D as in
D. Yeah, D.
Yes.
D. Yeah. The history never matches the finding. Never. It's always a different version. Always. Really good. Now, which assessment is most important for the nurse to perform before ambulating a client with history of syncope?
Blood pressure.
Blood
Everyone
pressure.
agree? Everyone agree with blood pressure?
Yes.
Now, how do you, as a nurse, assess a patient for orthostatic hypotension? How do you know that patient is suffering orthostatic hypotension? How do you
When they stand up, they have a drop in blood pressure.
Say that again?
When you stand them up, they have a drop in blood pressure.
Okay, yeah, that's good. But how do you assess? Okay, that how do you perform that assessment? Okay,
You make the patient sit on the bed first, just to make sure you can.
but how do you confirm that the patient has orthostatic hypotension? How do you assess the patient for orthostatic hypotension? How do you always say, hey, you suffer orthostatic hypotension, so you have to be careful you're getting up from bed because you will suffer dizziness and you can be at risk for fall. How do you do it? How does the nurse?
When the systolic drop off when the patient is standing.
Okay, only when the patient is standing?
When
they sit up as well.
That's it.
When he sit down.
Okay, the patient has to be lying in bed, so you will take the blood pressure lying in bed. Then 5 minutes after, you will ask the patient to sit down. You will take the blood pressure again, and then you will ask the patient to standing up, and you will take the blood pressure again. And when you have more than 20 dropping down, that will be orthostatic hypotension. You need to have, okay, blood pressure dropping down more than 20 or 20. And that's the criteria to diagnose as a nurse orthostatic hypotension. So remember, Nclex is policy and procedures. And out of time when you change those policies, you will be wrong. Everything is written based in a standard of practice. And you have a standard of practice of blood pressure, and you have a standard of practice, okay, for vital signs, and you have a standard of practice for wound care, and you have a standard of practice, okay, for everything you do. Nursing's practice act can change by state or United States, but a standard of practice doesn't change. It's the same standard of practice you practice here, it's the same you will practice in New York, it's the same you practice everywhere you go. And that's the reason you have to make sure that out of time when you change a policy or something, you're becoming wrong. So procedures needs to be, okay, learned in the way it is. Because for the Nclex, you have only one patient in an 8-hour shift. So whatever you learn from the real life, don't bring it over here. It doesn't help at all. But we need to know. We need to know. Okay? So it's good. It's 8. Now you say right here, no, that's really easy for you. Okay. Which client should the nurse assess first? A client with highest priority, ABC. We're gonna go over priority right now. I'm gonna give you some tips that I know is gonna help you a lot.
A.
A.
It's D.
A.
D, gastroesophageal reflexive reports increase in episode of belches and nausea. Now my question to you is to whoever chooses D. Is that expected from GERD? Yes or no?
Yes.
Okay. Any sign and symptoms expected for any chronic condition, or it's not a priority? You expect to see the patient having a hypertension. You expect to see, okay, the patient to suffer increase of blood pressure and when taking
The answer
antihypertensive.
is A.
The answer is A, but the tips for you is that any sign and symptoms that are expected, okay, from any chronic condition, okay, you can make a priority. It's a patient is a COPD patient and suffer dyspnea on exertion, that's normal. That's normal. If the patient is a diabetic patient and you give an insulin, regular insulin, okay, 20 minutes ago, and it's a risk for hypoglycemia, that is expected. That is not a priority. When the chronic conditions are diagnosed pretty much in your questions, they are not a priority. Because you know already what a patient has, and you know how to manage. But when you see a patient, okay, the right to medicine room will uncontrolled signs and symptoms, and the statement is not mentioning to you the diagnosis, well, that's my priority. Okay?
So,
And
Professor, acute always a priority over the chronic, right?
the what?
Acute is always a priority.
Acute is always a priority. Uncontrolled is always a priority. In the only situation, chronic conditions, okay, make a priority is when they mention it, that is the patient is suffering an acute as a patient on COPD or uncontrolled blood sugar, these type of words. You know, you suffer a chronic condition, but now it's getting back to acute, that would be a priority. But if they're mentioning a chronic condition with expected signs and symptoms, that's not a priority. And this is how the Nclex will evaluate the med search knowledge you have. And that's really important. So, and then give me something real. I'm gonna give an example. Let's go to B. Inflammatory bowel syndrome report left lower quadrant abdominal pain. Okay. I know.
Expected.
Okay. I know it's a left lower quadrant abdominal pain, but did I give you the pain level? Yes or no? In that answer?
No.
No, right?
No.
So that I'm mentioning that the pain is severe? No. That I'm mentioning it's an acute pain? No. That I'm mentioning it's no. Is I'm not mentioning how the pain it is. That cannot be a priority. You can have a left lower quadrant pain, but it can be in two. I don't know. It's a mild pain. That is not a priority. You know? So you have to look for a specific information. And that's really important. When you go to C, celiac disease who has developed frequent episodes of watery diarrhea. Is that expecting celiac disease, yes or no?
Yes.
So, not a priority. A GERD will report increasing on episodes of belching and nausea. That's normal in GERD. Not a priority. But now look A, an inguinal hernia who has developed an abdominal distension, it's complicated now, and fever in the last 8 hours, and even giving you a time. So it's measurable. Another time when you see an answer that it gives you a time and is measurable, that's your answer. It's very specific, it's very descriptive. Look for the more descriptive answer. We are out of time when you add something to your answer that is not there, you're becoming wrong. So I cannot add something, I cannot assume anything. I cannot assume in letter B what is the pain level because I cannot assume it. I have to play with what they're giving me, And this is the way it is. So you will look for the more, descriptive answer, the one that gives you more information, and that's an answer. And the more...
Just like the excessive...
Yeah, the most unconscious patients do. Got it what I'm saying?
Yeah.
And that's really important. That's really important. And always look at the time. In priorities, always look at the time. Surgeries are priority in the first 24 hours, not after 24. Not after 24. 3 days after surgery, it's not a priority, unless they're mentioning to you the patient is going back with something. But is they mentioning 3 days after surgery? Okay, no, that's not a priority. Because they're looking for post-operative complication, and most of the time, it's most of the time, occur in the first 24, not after. So look at the time out of times, or look at the age of the patient. It's going to help a lot. So, and right there, when you're establishing a priority, that can be assessed first or highest priority or whatever in your questions, you will look for 4 conditions. Number 1, alteration of the level of consciousness. Number 2, alteration of the mental status. Number 3, alteration of vital signs. And number 4, pain level between 7 to 10. Any of the answers that include any of these 4 parameters, that will be your priority. And when I mention alteration of level of consciousness, it's not the same, because that patient is unresponsive. That patient is completely stuporous. That patient is not responding. And alteration of mental status means the patient suddenly becomes confused. It's not the same. Or alteration of level of consciousness, not the same. And any alteration of vital signs always will be a priority. And pain level between 7 to 10. So it's easy. It's easy. Follow those 4. Huh?
Doctor, if they give you like a question, like a patient is hemorrhaging and another one has severe pain, so which one gonna be the priority?
It will be severe pain because, I'm not mentioning, on how many liters of hemorrhage do you have? And that's a good question. The nerve will say to you, never. That never will be in your question. The nerve is bleeding profusely and the patient has severe pain. Those 2 in the same questionnaire will be there. Never. Now, as I mentioned to you, the patient has a hemorrhage, but I'm not mentioning, is that hemorrhage profuse? Is severe hemorrhage? How many liters? Clots. I'm not mentioning to you in the hemorrhage is not a priority. I'm just saying to you the pain is severe. But what never and ever it's going to happen is that we says to you that the patient has a severe hemorrhage, profuse hemorrhage, and also severe pain in a different answer. No. Or one or another. Because that's the format. Got it?
Got it. Thank you.
Really good. Really good. Really good. After receiving morning report about 4 clients, which client should the nurse attend to first?
A.
Yeah, we just talked about that. What word do you have there?
Severe.
Got it. And not mentioning the pain level, that's the word severe. No way. And you know, at a time when you have close reduction of fracture femur, okay, and in close reduction, we expect to have pain, but the close reduction, okay, and open reduction means that the patient actually we have an screw and all these things, and it's a surgical procedure, and it's an open reduction. Close reduction, we're talking about pretty much tractions. And also cast can be, consider that too. Another time when you are putting on a traction in place, we expect that the pain level of the patient will decrease, not increase. Is after the traction is implemented, the pain of the patient, the pain level of the patient increases or becomes severe, it because the traction is misplaced. And we have to call immediately a technician, okay, or the doctor. So in order to reapply it, because we cannot remove traction to nobody. We cannot. We have to report to our PCP first. Okay? Good. Good, 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 good. That's so easy for you. Let's see this one right here. That sometimes, in teaching, the next is preparing a teaching program for new parents. Now, you have different categories in your Nclex. Physiological integrity, management of care, pharmacological integrity, and then health promotion. When you are looking right here and says to you, the nurse is preparing and psychosocial integrity, I'm sorry. I'm losing the file now. But the nurse is preparing or teaching a program for new parents. That word teaching is telling you that this question is about what? It's about physiological integrity. It's about health promotion. It's about psychosocial integrity, management of care. What that teaching means to you? What kind of question do you have in front of you right now? It's a physiological integrity question or it's a health promotion question?
It's a health promotion.
Health promotion. What's the level for health promotion? What the levels are? What do you know? Yeah, first
Primary.
level, second level, third level. Okay,
Primary.
in first level, what the first level includes? For me, first level health promotion to you.
Teaching the risk factor of the disease.
Exactly.
Prevention.
Education, right? So now, what about secondary, level health promotion?
Screening for disease.
Screening. I'm talking about labs, right? What about third level health promotion?
Treatment.
Management. Really good. So really good. Which means right here, I have a first level health promotion question right here because I'm teaching. You are preparing a teaching. So, well, let's go. The nurse is preparing a teaching program for the new parents to reduce the risk of occurring of ear infection in children with instruction to the nurse provide.
Hey.
Yeah, it's a.
Yeah, because second-hand smoke is a significant risk factor for otitis media. Yes or no? Keep child indoors in cold weather, so you cannot keep a child indoors in cold weather at all time. That doesn't make any sense. Take your formula feedings, with rice cereal. New parents mean the baby just born. I mean, you don't give cereals, no, to new infants. And collagen intake full high in vitamin C, no, still not. New parents means you are new parents. In English means that your baby just born, you never had a child before. I mean, it's sad, pretty much. You can use that strategy. But it's letter A. It's letter A, your answer. Okay? Or licensing assistant personal. Now, before we go over there, what is the concept do you have about UAP? What's the concept that you have about UAP? What means to you unlicensed assisted personnel? What's the meaning of that?
It's like a CNA.
It's only CNAs?
Somebody was helping in the hospital, something, but it doesn't have.
CNAs, UAP. CNAs, I'm sorry. PCTs, a medical assistant. When I'm mentioning UAP, I just including the scope of practice of all these people together. Okay, which means that on I cannot think only what the CNA does because CNAs they cannot monitor blood sugar, but PCTs they do. And when I mentioned, I'm including in my answers, okay, monitor patient blood sugars, you know, UAPs they do it because it's including PCT as core practice. So you have to be careful with that when you're looking at the questions talking about UAP. It's not only CNAs, okay? It's more than one scope practice together uh, in that abbreviation UAP, that classification. So let's go to the question. So the nurse assigns an analyzing assistant person UAP to administer 750 cc of cleansing enema to a client prior to the diagnosis procedure. The UAP reports to the nurse, and the enema was administered over 5 minutes and tolerated well by the client. What action is best for the nurse to take?
I should take B. B as a boy.
You say B?
Yes.
Yes, B.
Yeah, so the UAP and enema that the volume, okay, should be administered more slowly. Really, really good. Really good. A mother brings over 8 months old infants to the clinic because the child is beating other babies at the daycare center. According to Ferrer psychosexual development, the child is in what personality developmental stage?
Oh,
Oral stage.
Yeah, it's all stage because it's a months, right? 8 months of infant, and that the first stage includes pretty much infancy. Okay, really good. It's really good. Make sure you will know about Erickson. Erickson is most commonly than Freud, but Erickson is really, really common in your test. Really common. So you must make sure what is the meaning of trust and mistrust, industry and inferiority, on all these things. It's just really important. Okay, and yeah, they will ask you. They will ask you. When assessing a recently delivered multigravid client, the nurse finds that her vagina bleeding is more than expected. What factor in her history is likely to be most related to this finding?
she would be a multi-gravid. C.
C.
She should have 6 power 4.
The second
C.
stage of labor lasted 10 minutes. Okay, that's normal. Second stage of labor can last until 15 minutes, not a problem. Okay, second stage of labor, talking about delivery of placenta, and that can be, okay, pretty much from 10, 15 minutes, not a problem. Okay. Now, gravida 6 para 5 it is. So you're having 6 babies. So, having 6 babies, it can experience the uterus and the milestone, the uterus, okay, lose the milestone and develop a uterine anatomy. And that's a reason patient can be most at risk, okay, for hemorrhage. So it's letter C. She's over 35 years old, not a problem, and she received estradiol 2 milligrams, okay, IV during labor. I don't know if you guys know what is estradiol. It's not even related, okay, well, on postpartum bleeding at all. Okay. So it's, that medication. What's the medication for? What's the estado for? It's given during pregnancy.
Pain. For pain.
It's kind of given to pregnancy. It's an opioid medication, and
Mm-hmm.
you cannot even given during on. It's pretty much sometimes in some patients can be found to be given to relieve pain in the first stage of labor, but it's a narcotic, and it's even more potent than Demerol, and they're gonna give it has to be pretty much in a small doses, 1 to 2 milligrams, but it's really not really good because it will delay the progress of the labor, and it can be really harmful for the baby. So, but it's not really with hemorrhage at all. 36. A client telemetry monitor indicates ventricular fibrillation. What should the nurse do first?
D.
Prepare to defibrillate.
Defibrillation, CPR. Okay, do the defibrillation and then CPR. Okay, that's really important. So after you deliver one child, then resume CPR immediately. A lot of people choose this opposite, but it's like that. Really good. And in preparing a post-operative client for discharge, which task can be assigned to licensed assistant personnel who is assisting the nurse?
A.
A.
Yeah.
Remove the
Yeah.
sequential compression devices. Really good. Really good. Really good. Really good. A client who suffered a stroke and is now ventilated receives nutritional supplements by tube feeding 2 times a day. The next is a client for receipt of volume before administering the next feeding, which statement best describe the rationale for this nurse intervention.
B.
B.
Retention of feeding in the stomach increases the alcohol overregulation and aspiration. You say or B?
B.
B
B.
as
B.
really
B.
good.
B.
B as a boy.
Okay, let me look for something else right here. Okay, let's go. After traumatic injury, 20 years old clients diagnosed with syndrome inappropriate anti-thyroid hormone in an early stage of this disorder, which finding to the expect of this client to exhibit.
C.
C.
C. Use antimicrobial soaps to reduce infections or infection risk. Uh, well, the use of antimicrobial it will promote dryness.
No, question 43, Professor, not 44.
Oh, I'm sorry, it was a 43. Oh my God, what I'm doing 44. Okay, on what do you choose there?
C.
B as in boy.
No,
So,
C.
okay,
Copious amount of urinary output.
copious amount of urinary output. Really? Really?
No,
Syndrome in
it's B.
inappropriate hormone. Do you suffer polyuria or not?
Urinary retention.
Exactly. So copious amount of urinary output, not good at all. Because you're not making pee at all. So you have an increase of ADH, you're absorbing too much water from kidneys back to the circulation, so you're not making pee. That would be diabetes insipidus, not here.
That's B. No. Syndrome of inappropriate antibiotic.
B? No, cannot be.
It's B, Professor.
Everybody will be a some boy.
Yes.
What happened with the plasma in SIDH? What happened with the plasma?
Hyponatremia.
Yeah, but what happened with the plasma volume? Increases or decreases?
Increases.
So out of time when you have an increase of the plasma volume, this platelet blood pressure is gonna go up.
Mm-hmm.
Okay, and that's the reason patient will suffer hypertension. Okay, plus delusional hyponatremia. It's not a regular hyponatremia, it's a delusional one. And in delusional hyponatremia, the patient will suffer bradycardia. So as you look right, it's very contradictory. Okay, that's the battle signs, but that's the way it is. So you see a patient having hypertension with bradycardia, and it's normal. Okay, good. It's B. It's B. When bathing and decline, the nurse know that the client's skin is very dry and flaky and raw, which nurse intervention should be added to his client plan of care.
B.
I agree, B.
Decrease
Yeah,
of bath to every other day using non-irritating soap. Yeah, it's true. It's true. The next assessing a newborn infant, which assessment findings are an early indication of a possible cardiac problem.
C.
yes.
C.
Acrocyanosis or hands and feet.
No, it's
D.
wrong.
D.
It's B.
D.
Acrocyanosis is normal.
It's B.
It's normal. It's B.
B.
Yeah, what is the normal respiration for newborn infants?
30 to 40. Oh, no, I'm sorry. 40 to 60? Uh-huh, 68. 78.
What is the normal, sorry, you break down, what's the normal respiration rate for infants?
For newborn infant is
30 to 60.
30 to 60 breaths per minute. So they're having right here tachypnea, right? It's not good. So 78 breaths per minute. That's the reason we need to know vital signs. Okay, and that's the reason, isn't it? Possible cardiac problem. Look at the respiration, it's really high. Heart rate in neonates, okay, can be high as 170. And then after a month of life, it can go from 120 to 160. Okay? So for that reason, A is not a priority. C is normal. And muscle tremors, okay, well, okay, pretty much in children can be related, okay, to neurological impairment, but it's not, okay, an indication of cardiac problem. But this was the question is asking for pretty much. Okay, so when you look at the 70A, it can indicate on sometimes even fluid on the lungs, okay, in newborns. So we have to be careful. Okay. Now, 46. The respiratory therapist preparing to assist postoperative client with an incenting speedometer has requested a licensed assistant personnel help turn the client from lateral to supine position for the procedure. What action should this implement?
D.
We have some boy.
Yes.
Yeah. Position, because the help the therapist, okay, turn the client to supine as requested. No. It says what should the nurse, okay, implement. What would the UAP to position the clients in the full position for the procedure? Yeah, that's your answer. So advise the therapy? No, you cannot advise the therapy, and until the therapy is returning 2 hours when the client will be turned to supine position. No, supine no. And A and B, assign UAP to have the therapist turn the client to the supine position as requested. And again, supine position, no. Inserting a speed over in supine position doesn't make any sense. It has to be semi-folder. Really good. Okay, it's B. It's B. During a family basketball game, an adult male is hit on the head with a bat and he suspected sustaining epidural bleed. What is the most important information for the medical center nurse to obtain from the client's spouse who witnessed his injury?
C.
C. Was your husband knocked out by the blow?
C, what else do you choose? D, you say? Anyone agree with C?
C. Yes, C.
Is everyone agree with C?
It's C.
Yeah, because that will differentiate between a subdural and epidural hemorrhage.
Yeah. And it's important to determine the consciousness at the time of. Yeah, because when we're talking about epidural, bleeding, we're talking about and we're talking about pretty much about a brief loss of consciousness at onset. When it happens, they're gonna have a brief or loss of the consciousness. It's a big called knockout, so we need to know because knockout means you're unconscious for a while. And that happened, pretty much in epidural bleeding. Okay, so really good. Which statement by a school age client going to summer camp indicate the best understanding of the mode of transmission of Lyme disease?
Let's see. You have to wear a long sleeve.
C. Who transmitted the Lyme disease? How it transmitted?
It's an insect.
When it
Mosquito
bite.
Mosquito bite.
Really good. Okay, really good. Really good. And how do you describe the rash for Lyme disease? Nclex does that. Nclex will give you the sensation rashes.
It's a bull eye.
Butterfly.
As a target.
It's like a bull eye or a target, yeah.
Bull eye rash. This is how the Nclex describe it to you. Let me tell you something. Nclex will describe the rash. Nclex will ask you about positions. Nclex will ask you about the signs. You need to know about muffin signs. Blue sinking sign, kerning sign, turning sign, cooling signs, ilioxoa sign. You need to know about that. Telendenburg sign. You need to know about all those signs because they will ask you. And you need to know about positions. In which conditions we place the patient in Telendenburg, reverse Telendenburg, modify Telendenburg. That will be in your test. Semi-folder, semi-sideline, sideline. You need to know. 15 degree, semi-folder, 30 degree semi-folder, 90-degree high folder, prone position, because in some situation we have to place the patient in prone position. So you need to know, it's really important, because they will ask you all that. This test is about nursing intervention, so you need to know all of that. And that's really, really important. Okay, so now according to the conditions, okay, you need to know, and the signs and symptoms that give you need to know. Okay, to learn the more left sideline, to learn the more right sideline, it depends for air embolisms or fat embolisms, you need to know. They will ask you. You need to know about pictures. You need to know about pictures. EKGs will be your test like crazy. So you need to know all different type of EKG. And what they're doing right now is that it's not like before, they will give you a picture and then you identify an EKG. Is that they give you a picture of the EKG, and then after you identify the EKG by yourself, you have to choose the medication that the doctor is going to provide for that, or going to prescribe for that. So, you know, even more difficult. If you identify the EKG wrong, you will choose the answer wrong. And pictures, a lot of them. Herpes zoster is there. Where the fertilization occurred is there. Where you will provide pretty much a ventral gluten injection is there. When you are gonna auscultate the Epps point for diastolic sounds, it's there. So we need to know about pictures. And we have pictures about rashes, and we have pictures about. So you have to go prepare for your Nclex. It's really important. And many questions about description of rashes, scabies. Okay, they describe the rashes, scabies, and they don't mention scabies to you. They describe the rash to you, so you need to know. So you must make sure when you're reading, you may finger points in the most important information you need to know. Okay, of each of the conditions of whatever you're reading, because that's really important. Nclex is not easy, okay, but it's doable if you study. Okay. How do you know you are ready for your Nclex? When you're just eating, you're having a family dinner at home, and you're just eating, and people's talking to you, but you don't listening. You don't listen to what people say. You just try to remember something, and then you say to them, "Hey, I'm going to a restaurant," and then you're going back to the bedroom. No one is looking at you, and you're looking for the information. You just forget. That would be a good sign. Because when you're ready to the Nclex, you don't relax yourself at all. You can't. So it's really important that you go prepare. It's really important that you go prepare. Okay, as much as you can, because you never will be prepared for that. Okay, and if you are obese or you are overweight, don't lose weight right now. It's not time to change your lifestyle. You smoke, continue smoking, and you drink coffee, continue drinking coffee. And when you go to the Nclex, try to wear a common clothing that you usually wear. Don't try to go so it doesn't work. That increases anxiety level. It's not the time to stop anything you usually do. Not at this time. So those tips help, but you must make sure that you go prepared. Okay? Let's continue. A client, who was in a house fire is brought to the emergency department. Which assessment finding should the nurse respond to first?
A.
The client voice is hoarse and things are here. It's because that means The voice quality and the NSA here indicate that it's a big neck weight injury and high risk for edema. Okay? And yeah, really important. A client is planning to take a trip among to a country where malaria is prevalent and asks the nurse about how to prevent malaria. How should the nurse respond?
C.
B.
C. Medication should be taken both before and after exposure.
There's no vaccine for the malaria.
It's C.
There is no vaccine for malaria. That's good. Now, medication should be taken before and after exposure. That sounds good.
Yes.
That sounds good.
Yeah, that's what we do. Okay, it's taken to prevent malaria, both before and after exposure. You know, but no, it's not good. It can be used as you become infected. Okay, pretty much with malaria, that's not a prevention. Vaccination doesn't exist. It's already too late for severe preventive doses. It's not true. Okay. It's letter B. It's letter C, I'm sorry. Okay. Good. A middle-aged man walks into the emergency center and collapses at the triage desk. What action should the nurse implement first?
It's D. We have to make sure that the patient is conscious or unconscious.
Yeah, we have to make sure the patient is unresponsive or it's responsive. Really good. Really good. And it says right there first. Doesn't mean first is the highest priority. No. If I'm going to the restroom right now, what I'm going to do first, standing up from the chair. Stand up. That's the first thing I would do. But doesn't mean standing up will be the highest priority. Got it? Be careful with that.
Yeah.
It's not the same. Okay, I know the highest priority for the patient, it will be give oxygen, but what I gotta do first, okay, place the patient in semi-folded position. Do you understand the idea of what I'm telling you?
Yeah.
Good.
Yeah, we got it.
Yeah, those concepts has to be clear for you. It's not the same. You like the way we're doing this?
Yeah.
Yes. Yes.
Yes.
You're comfortable. Really good. And anything else? You have a question on something you're reading it? You just want me to go over the subject or something? Just let me know. I can answer. Okay. I mean, wherever you ask me, if it's on my reach, I will. Let's see right here. Something good. Priority. The charge nurse assessing care for 4 clients. Which client should the charge nurse tell the assigned register nurse to assess first?
A.
Is expected for your non-over extremities for Guillain-Barré?
Yeah, it's expected. It's B.
It's expected, not a priority.
B.
Not a priority.
Oh, I'm sorry. Yeah, I was thinking of ascending.
No.
Don't worry about it, but it's good. You're grasping it, which is good. An 18 years old with 65 roses with pulse oximeter rating is a 90. Let's put it in home. Elderly client with tuberculosis was complaining about being in isolation. That is not normal. Yes, it is. Yes, it is. An adult myasthenia gravis whose arterial blood gas reading 7.36. That's not a problem.
SD.
5 is not a problem. O2 is normal and carbonate is normal. The arterial blood gases is normal. It's no problem with myasthenia gravis. So letter B is a 1. 65 roses with pulse oximeter reading is a 90. It's a risk for hypoxemia, right?
Yeah.
Professor, I have a question. For can you clarify for COPD, for example, what should be the O2 sat, for example?
86.
Normal. I mean,
86.
expected. I mean, yeah,
86.
86 for
Yeah.
COPD, right?
86 for COPD patients. Lower than 86 is a priority.
Okay.
87, 80, 88, 89 is expected.
But normally lower than 90 is a priority. I mean,
Yeah. For
yeah.
now COPD patients. For now COPD patients.
Okay.
Okay. For COPD patient has to be lower than 86. Got it now?
Yes. Thank you.
Yeah, because they have a chronic obstructive pulmonary disease. So, and right there, we expect to see a hyperinflating alveoli. And you know, the hyperinflation of the alveoli is what it's going to make these autos have to be lower than normal people. And in some of them, they have a bulla. It's a bulla. It's a bulla. It's like a blister or okay of air inside the lungs that when they're trapping more air into that bulla, it can make a lung collapses. And that's a reason for that restriction of the breathing and ventilation and all of that. So we expect to see that they're going to have okay an ultrasound lower than 86, but 86 is still normal. Okay, they always will have carbon dioxide higher than oxygen, always. So okay. Now, that is teaching a mother about normal growth and development for her 6-month-old daughter. Which statement, I'm sorry, by the mother indicates the child has reached the appropriate developmental milestone.
Will be.
My child seems to cry every time strangers come around. And yeah, I'll bring him to a stranger. I'll bring him to a stranger. That's really good. Okay. 68. A family member brings a garden salad, fresh fruit to a client who's receiving chemotherapy for a malignancy and has an accident neurotrophic count of 500. How should the nurse respond to that?
Explain the risk of infection related to fruits and vegetables because they're raw.
Yeah.
Yeah.
Okay. Now, how do you name that kind of isolation precautions in patients in chemo on a trophic count lower than 500? What's the name of the isolation precaution you will implement for patients that are immunocompromised?
Neutropenic.
Protective.
Neutropenic, protective, what else? Reverse. Yeah, and all of them are the same. So you have to make sure no plants in the rooms, no flowers, no peeling fruits. The only fruits allowed is banana. No, nothing else. And if they're gonna bring vegetables from home, it has to be in a well-cooked vegetables. Okay, so well-cooked vegetables allow. Fresh. Okay, fruits and vegetables not. Okay. Now, what is the normal CD4 for HIV patients?
Like 100,000.
CD4 count for HIV patients.
500 and 1500.
Okay, really good. Now, when do you consider the patients has to be in neutropenic precautions in patients with HIV? What would be the CD4 count to play the patients in neutropenic precaution?
Less than 200.
Less than 200. When they're less than 200, that risk for
Infection.
an AIDS. Really good. Then we ask you for that. So you need to know the count of the CD4 for HIV, okay? You need to know that because then we ask you. see what else. A client receiving nitroglycerin via transdermal patch reports feeling dizzy while ambulating to the restroom. What action should the nurse implement first?
D.
D.
You see, ask the client to sit on the side. Yeah, it's the first thing we do because we have to minimize. Okay, falls. Really good. Really good. While the nurse is inserting an altitude, the client becomes dyspnea and cyanotic. What action should the nurse implement first?
C.
Everyone agree with C?
Yeah.
I'd say connect the NG tube.
Oh, C.
No, C.
Getting dyspnea and cyanotic. What does that mean? Is that it's getting into a trachea, right? Yeah, it's getting into a trachea, and for that reason becomes dyspnea and cyanotic. So the first thing we have to do is to remove it. Okay. Yeah. It's you cannot connect it to suction. You have to remove it immediately. Okay, minimizing a respiratory distress and bronchoaspiration with all of that. Okay. Let's go to next. That's so easy for you. An staff RN assigned as a primary nurse for a group of 5 clients called the nursing supervisor to report that she will be 2 hours late for her assigned shift. What is the best action for the nursing supervisor to take?
Easy.
Reassign an RM front and in-house flow pool to care for these clients. Good. Stop. Let's go to 81 EC. Yeah, did you see it? See? Yeah. The next assigned a Glaho, common scale of 7 to 2 years old, who was admitted after head injury to the left occipital area. What description should the nurse use in the narrative documentation of the child level of consciousness?
Seven. It's comatose.
No, I say.
It's comatose.
No, 7.
Yes,
7.
yes, 8. Comatose.
7 or less are considered comatose.
No.
It's 8.
7 to 10 is normal.
No, 15 is normal.
I would say B, stupor.
I would say stupor is B.
B is stupor.
B.
Okay, whoever had Glaho scale lower than 8, it means that it's a comatose patient.
Okay.
It's in coma. Lower than 8 means the patient is in coma.
Coma. Yeah.
Huh? Say that again? Yeah. And that's what the Nclex they do. They will mention to you Glasgow scale, okay, of 8. Okay.
So, Professor, when is it considered stuporous and obtunded?
Well, obtunded, okay, and stuporous, okay, is completely different. So when we are, okay, pretty much on mentioning, okay, the word obtunded, and that means, let me see, how can I describe that to you?
Scale like for
Pretty much like
range for
reduce
obtunded and
alertness and consciousness. There is a reduce of the level of alertness and consciousness. That's what it means, okay, pretty much on obtunded, on that can be patients, for example, when they have okay, pretty much on when they have pretty much on a head trauma, okay, they can be obtunded. It's, the level of the consciousness and the alertness, okay, pretty much is on it's pretty much decreases, okay, pretty much impaired. Now stuporous is completely different. Stuporous is a condition, okay, in which is completely suspend the sense of sensibility. And so an example of that can be on when you're getting drunk, it's nearly to unconscious, but you're not completely unconscious, okay, which is not the same. But it's when you are on like a chiefly mental condition is marked more for the action of spontaneous movement or diminished responsiveness to stimulation, and you have an impaired consciousness. Okay, but you're not, okay, pretty much completely unconscious, which is in comatose you are. Okay, got it?
yes. No, I thought there was like a range for comatose patient less than 8. I thought there would be one for stuporous or obtunded, for example.
No, because comatose, you are in coma. You are unconscious completely.
Yes, I understand.
Yeah. And always when you have on a Glasgow scale lower than 8, you are classified as an comatose and coma patient. Yeah. A male who has a serum potassium level 5.9 tells that he has decided to leave the hospital even though his care provider has not discharged him. He says that he does not care, he's discharged and is refusing all treatment. It is most important for the nurse to ensure that the client understands which fact prior to leaving the facility.
Sí.
See?
Yeah.
C,
Sure.
C, and then A.
Mm-hmm. Very good. Now, 83. The nurse is present when a male client dies and his wife is also in the room with him. What is the best response for the nurse to make at this time?
I think it's A. Express sympathy over the wife's loss.
I would say D.
Yeah, we'll see the.
I don't think sympathy is the right
Sympathy over my loss.
Sympathy would not be right.
It's A. A.
Nurse is saying when a male client dies and his wife is also in the room with him. What is the best response for the nurse to make at this time?
It's A.
And
I mean, the nurse would express empathy, not sympathy. So
exactly.
I would say
That
B.
is wrong. You
It's empathy, no?
empathy, no sympathy, because empathy is good, but sympathy is wrong. So that question is formulated wrong because the answer must be A, but now with sympathy, it must be empathy. Because you cannot do sympathy with no one. It has to be empathy other times.
Could be then empathy, right?
Yeah, it has to be emphatic, not sympathy. So I will say that, okay, the question can be A, but if you change sympathy by empathy, that question is formulated completely wrong. Okay, so let's go to 85. It's wrong, the question. Okay. When planning home care for a child with juvenile rheumatoid arthritis, which recommendation should the nurse provide to the child parents?
B. Was a child in a warm bath every morning before the activity.
It's B.
Yeah. Yeah. Yeah, you better wait. Warm bath immediately after waking decrease the pain and increase in mobility. And that's a reason we try to provide warm bath today every single morning. Okay. Okay, guys. I'm gonna send a new link to you tomorrow to all your emails. So be pending on that link, because for some reason I have a severe problem today. Okay, with the links and the things, and it was a nightmare. I couldn't log in. They don't. I mean, huh? I don't have the approval for. I mean, for some reason, something happened with the link. So we send tomorrow in the morning a link